I'm Juan Taveras. I'm a cardiologist, specialized in cardiac arrhythmia devices. But my specialty it is to take care of patients who have rhythm disturbances and need a device. For example, a pacemaker. One of the most exciting ones is now the leadless pacemaker. It's a very, very small pacemaker. We go from the groin. We don't have to do a chest wall incision. We don't have to open the chest up. So you just go from the groin and insert it into the ventricle. Very exciting technology. And now, one of the things that I like the most is a biventricular pacemaker. It's a pacemaker or a defibrillator that is connected to the heart with 3 wires. And what it does is that resynchronizes the heart. The quality of life that this device implantation gives the patient is amazing. Because you go from not able to walk, not able to breathe, having swelling of the legs, not able to lay down because you're short of breath all the time, to being able to do your normal activities. You know, I love talking to the patients because it's a relationship that is not necessarily, many times, as a doctor and patient, but it's a friend. You can imagine when you were a healthy person, you were doing all your normal activities, and suddenly you lost your ability to perform like you used to be. That takes a toll on your personality, that makes you sad. I like to listen to them, to try to empathize with what they say, how they feel, and try to come up with something that makes them happy. You know, besides taking care of their physical ailments, that part usually makes me connect with them, and that I think that's made me very good in terms of being able to understand what the patients feel and how to take care of it. Cardiology Care Consultants was founded in 1991. Our former partner, Dr. Quintana, retired, and we always had a cohesive group. We decided from get-go that everyone, even though we know everything or we pretend to know everything, every aspect of cardiology, we try to divide into the areas of our most expertise so that we can offer the patient the best care in terms of what we know the best. We don't think we're superhumans. We try to be humble and divide the work into the most expert physicians that can do the best job for the patient. That's our philosophy.